بسم الله الرحمن الرحيم. سنتكلم في هذه المحاضرة الجديدة عن ال Public Health Code of Ethics، ونبدأ بالتعريف ال Public Health بشيء مختصر، ونتطرق بعد ذلك إلى مضمون ال Ethics. What is public health? Public health is the science of protecting and improving the health of people and their communities. إذن هو الهدف منه protect, improve the health. Public health improves human quality of life, helps children thrive, reduces human suffering, and saves money. بشكل عام. The public health field is working continuously, often behind the scenes, to prevent hazards and keep people healthy. An example of some public health activities: tracking disease outbreaks and vaccinating communities to avoid the spread of diseases, setting safety standards to protect workers, developing school nutrition programs to ensure kids have access to healthy food, advocating for laws to keep people safe, including smoke-free indoor air and seat belts, working to prevent gun violence and all other forms of violence, addressing the impact of climate change on our health, and declaring racism as a public health crisis. Public health is a multidisciplinary profession, including numerous specialized bodies of knowledge and practical experience useful in service to society. فالpublic health is not a disciplinary that takes under consideration only one discipline or one knowledge, one science. It is an umbrella that comes under which a lot of disciplinary, like biostatistics, maternal child health, health education, epidemiology, environmental health, health administration. A lot of these disciplines are included, and others under the umbrella of public health. So public health professionals work to prevent problems from happening or recurring through promoting health lifestyles. This is mostly the work of field public health, promoting healthy lifestyle, and by implementing education programs, recommending policies, researching disease and injury prevention, detecting, preventing, and responding to infectious diseases, administering services. All this is in contrast to clinical professionals like doctors and nurses, who focus primarily on treating individuals after they become sick or injured. So public health also works to limit health disparities. A large part of public health is promoting healthcare equity, quality, and accessibility. So overall, public health is concerned with protecting the health of entire population, as small as local neighborhood or as big as entire country or region of the world, and working in a variety of settings, including local, national, international, governmental, non-governmental organizations, NGOs, and academia, and others. Practitioners within each setting come from numerous scientific and technical areas of study. Public health is an evidence-informed practice. It's not based on any other thing than the evidence. The evidence comes through a lot of research, of course. Public health actions are based on scientific observation and inferences, lived experiences, and what is valued by public health practitioners. Public health decisions affect the health and well-being of diverse individuals, groups, and communities. So if we come to the ethics of public health, we would say addressing complex ethics questions require public health personnel to have a set of skills that include the ability to identify the ethical dimensions of public health work, articulate conflicting values and ethical dilemmas when they arise, deliberate on options and courses of action using inclusive methods that engage individuals and groups affected by public health work, and implement and evaluate solutions to keep the process open for revision, especially in situations where information is limited or developing quickly. طبعا هذه مختصر لبعض السكيلز أو الابيليتيز اللي تكون موجودة عند كثير من المفوضين أو العاملين في الببليك هيلث. لكن إذا اجينا للتكنيكال abilities, mostly it would be through analysis of situations and analysis of data and trying to understand the problem through collecting a lot of data and analyzing and then reporting these data in form of articles, publications, reports, policies, and so on. So the public health uses the notion of flourishing or well-being or healthy, which has a broader, more inclusive implications. With the appropriate support, many live well with impairments or illnesses. It means that even if they have disease or disability, they are supported. Programs exist to support them and alleviate these burdens. As used here, healthy does not focus so much on biological function as on the social conditions of capability and opportunity upon which health itself and many other goods depends. وبالتالي هذا يرجع إلى تعريف الصحة المعروف من قبل منظمة الصحة العالمية والتعريف المعروف عالميا. It's merely the absence of disease، لكنه هذه تعريف الصحة، وإنما هي الصحة في كل ما يتعلق بالإنسان من well-being, healthy lifestyle, social and psychological healthy well-being. Flourishing refers to what individuals and communities experience when institutional and cultural structures create the opportunity for people to realize a wide range of potential capabilities inherent in all human beings. So it is about creating opportunities for people to realize a wide range of potential capabilities. هذا الإنسان لديه capabilities و potential for those capabilities، إنما ربما يكون الإثكس في public health practice أنه نصل إلى flourishing وهي well-being من خلال realizing the potential capabilities في الإنسان. Flourishing occurs when capabilities for agency, creativity, intelligence, understanding, emotional engagement, and other positive human potentialities take shape in the form of lives well lived. As such, we take a life course, a perspective that examines public health issues from maternal and child health into old age, while recognizing specific vulnerabilities at the extremes of age. يعني الحياة تعاش ب well lived، ألا يكون فيها عدم القدرة على الحياة أو أنه يعيش الإنسان كما يريد بكل ما يتطلب ذلك من التزامات أو أمور تساعد على العيش well lived. إذا أجينا إلى الكور values في related obligations في public health، نتطرق إلى شيء اسمه professionalism and trust. The effectiveness of public health policies, practices, and actions depend upon public trust against or gained through decisions based on the highest ethical, scientific, and professional standards. أيضا هنا كما تطرقنا في السابق إلى التراست عند الطبيب بين الطبيب والمريض، أيضا التراست والبروفيشناليزم مطلوبة في الببليك هيلث. So public health gains public trust in part because its practices are informed by evidence. إذا ما كانش في evidence معناته الببليك أيضا ما هواش stupid حتى to realize إنه والله what they say is evidence. No, it is the evidence that make them say that, not what they say is evidence. When the needed evidence is lacking, public health seeks it. And when the evidence reveals faulty or inadequate practices, public health seeks to improve those practices. So as I said, we don't determine by ourselves the evidence by saying this is an evidence without being an evidence. The evidence is based on a lot of research, a lot of work, data collection, analysis, and then the conclusion, which is an evidence based on the design of the studies and so on. At times, public health practitioners must respond to a situation in the absence of complete scientific information, which highlights the importance of having an ethical framework to drive decision making. طيب لما ما يكون في عندنا evidence or at least some data that would support our action or decision, بدنا نتحلى أيضا في الethical framework. So public health practitioners and organizations promote competence, honesty, accuracy, and ensure that their work is not improperly influenced by secondary interests. Public health decision makers need to be transparent and honest about dislocating conflicting interests and influences. طيب إذا ما كان هناك if there was not an evidence that support the decision, at least don't be biased and influenced by secondary interests. It means that some of those people or people with influence, they would interfere with your decision and you would make decision in favor of their interests, which is wrong. So, health and safety. Health and safety are essential conditions for human flourishing. Public health practitioners and organizations have an ethical responsibility to prevent, minimize, and mitigate health harms and to promote and protect public safety, health, and well-being. So, it's a big and important heading about health and safety, interchangeable health with safety, because you cannot be healthy not safe and you cannot be safe and not healthy, so they have to one lead to another. They are essential for human flourishing. If you are healthy but not in safe conditions, it's not flourishing. So it is an ethical responsibility to prevent, minimize, mitigate health harms. For example, you consider yourself healthy but live in a hostile environment where air pollution or other forms of pollutions exist. So you have to mitigate these conditions as public health. Health justice and equity. Human flourishing requires the resources and social conditions necessary to secure equal opportunity for the realization of health and other capabilities by individuals and communities. وبالتالي هذا أيضا يمشي مع عنوان أو مع مبدأ اللي هو justice. الجاستس أيضا أنه حتى الإنسان يعيش في بيئة ويعيش في بحبوحة من العيش من كل النواحي. realize health and other capabilities في سواء بالشخصية أو المجتمعية تكون social conditions, equal opportunities. It is an obligation to use their knowledge, skills, experience, and influence to promote equitable distribution of burdens, benefits, opportunities for health, regardless of an individual's or group's relative position in social hierarchies. Interdependence and solidarity. The health of every individual is linked to the health of every other individual within the human community, to other living creatures, and to the integrity and functioning of environmental ecosystems. Public health practitioners and organizations have an ethical obligation to foster positive and mitigate negative relationships among individuals, societies, and environments in ways that protect and promote the flourishing of humans, communities, non-human animals, and the ecologies in which they live. Attention to potential intergenerational conflicts over resources can sometimes be essential. إذن هذا مبدأ اللي هو السوليداريتي والانتردبندنس، إنه أنت ما بتقوم لوحدك وتعيش لوحدك بدون تفاعلات مع المجتمع والبيئة المحيطة. فبالتالي foster positive, mitigate negative, human community، المعاني هذه كلها functioning environmental ecosystem. فبالتالي بحاجة إلى العمل على تنفيذ مثل أو يعني تطبيق مثل هذه المبادئ. Human rights and civil liberties. While coercive legal measures limiting behavior can be ethically justified in certain circumstances, لكن overall the effective and ethical practice of public health depends upon social and cultural conditions of respect for personal autonomy, self-determination, privacy, and the absence of domination in its many interpersonal and institutional forms. صحيح إنه كثير من الأحيان إحنا نفرض على الناس إجراءات معينة طبية صحية من أجل صحة المجتمع وننسى حقوق الفرد في بعض الأحيان، وبالتالي زي ما هو معروف إنه والله هذه الإجراءات تكون justified in certain circumstances، لكن اللي هو social cultural conditions بدها تراعي أيضا respect of autonomy, self-determination, privacy، وأنه ما يكون في هناك domination، سيطرة من قبل موجهة على آراء الناس أو تصرفات الناس. أيضا inclusivity and engagement. Preventing adverse health outcomes and protecting and promoting the flourishing of individual societies and ecosystems require informed public decision-making processes that engage affected individuals and communities. It means that هذول الناس اللي أنت بدك تحامي عنهم أو بدك تسعى إلى إسعادهم أيضا شاركهم في المعرفة والقرارات. Public health practitioners and organizations have an ethical responsibility to be transparent، مع الشفافية، ما تخبي عنهم شيء إذا كان يستطيعوا يعني to handle these facts, to be accountable to the public at large, and to include and engage diverse publics, communities, or stakeholders in their decision making.